Welcome back to Pulse Education. My name is John Carrico. This week we're talking all about left axis deviation. So this is part of an ongoing series that we're doing about 12 lead interpretation and specifically taking a disciplined approach to that, to 12 lead interpretation. Okay, we talked about in our first videos about rate and regularity, and now we've been working our way through axis deviation. So last week's video, which I highly recommend you watching, is all about axis itself and specifically normal axis. And again, this week we're getting into left axis. And specifically, we're going to talk about causes and what it means for our patients when they're having left axis deviation. Okay. Hopefully we're going to really get this explained so you have a good understanding of that. So let's jump right into talking about axis again. All right. So as we talked about last week, axis, all this means is axis is the average direction that depolarization is having in the heart. And typically, again, starts in the right atrium and it's going to kind of finish, that wave kind of finishes in the apex of the left ventricle. That's normal. But obviously, if we're talking about this now, right, that we can have it when the axis is going to swing, and we can either swing to the right or the left. And so this week, obviously, we're talking about left axis deviation, all right? So as we talked about last week, axis, all this means is axis is the average direction that depolarization is having in the heart. And typically, again, starts in the right atrium and it's going to kind of finish, that wave kind of finishes in the apex of the left ventricle. That's normal. But obviously, if we're talking about this now, right, that we can have it when the axis is going to swing, and we can either swing to the right or the left. And so this week, obviously, we're talking about left axis deviation. All right. So again, as we said, as conduction moves down, as depolarization moves down conduction pathways, which it's supposed to, the cells fire off, and all those myocytes along the way get that signal, and they are able to fire off and do that efficiently. Okay, and that's where we get our normal depolarization wave from. So in left axis deviation, there's a couple of reasons that we can see that that axis itself, or that average direction, is now moving over toward the left-hand side more than it was under normal depolarization, all right? So we've got to shift more toward the left ventricle, okay? And there's a couple different things that can cause that we're going to talk about. So the first thing that I wanted to point out is that when we have a conduction problem, or we've got a lesion or a defect within the left bundle branch itself. So remember, the left bundle branch is the main conduction pathway that the signal, depolarization signal, is going to travel down, that it's going to cause that left ventricle to fire off, and to fire off efficiently when that happens. Well, if we have a defect in there, then what's going to happen is that signal travels down the conduction pathway, and it gets to that point, it's not going to be able to go through that defect and no longer travel down that left bundle branch, okay? So when that happens, now, in order for that left ventricle to fire off, that signal has to go cell to cell to cell rather than down that efficient conduction pathway. And then what we see then, and obviously we've got our little arrows on here to help us guide that, is that now that depolarization wave has traveling cell to cell to cell, right, moving in that leftward direction, okay? And again, axis is all about the average direction that depolarization is happening. And we can see on here via these little yellow arrows that kind of represents that average direction that's happening as each cell is having a fire off in that way. And that's going to cause the axis, or the average direction, to move a little bit more toward the left-hand side. All right. Again, another reason that we can see that is when we have increased demand on that left ventricle, and especially if we're talking about this chronically. So one of the things that happens within patients is that, especially patients who are sick, or patients who live a very stagnant life, or are patients who are obese, even morbidly obese, is that the heart has to work harder every day, okay? Especially as we add more weight, that means more blood vessels, that means more body, and the heart itself has to work harder. And as that heart has to work harder, that left ventricle, just like any muscle in the heart that has to work hard, is going to get bigger and bigger. And as it gets bigger, obviously that means more myocytes are added, okay? And that means more energy is required for that left ventricle to fire off, okay, to squeeze. And that is then going to take what was normally our average direction, is now going to move it more toward the left sides, because simply, one, there's more cells now on the left side than there was under a normal trophic heart. When we see a patients who have left ventricular hypertrophy or have increased demand on that left side, that is going to take the average direction and shift it more toward the left, as we can see here in this illustration. And then finally, if we have an infarction on that within that left ventricle, so an infarction, remember, is those are dead cells at this point. They're not getting blood supply. They're not actually able to perform their job anymore, and they're certainly not going to depolarize. And so because of that, if we got an area of that heart that's not doing that, the same thing that happened earlier in terms of as that depolarization moves down conduction pathways, once it hits that infarcted area, it's not going to be able to travel through it, and then the cells are going to have to go around, and that means going cell to cell to cell again and moving in that general direction, okay, moving toward the left side, especially if this infarction is within the left ventricle. So conduction problems within the left bundle branch, increased demand within the left ventricle, or an infarction within that left ventricle are all reasons that can cause left axis deviation. So let me cover a couple causes of left axis deviation, all right? So I've mentioned or kind of hinted at some of these already, okay? And this is this list, and I'm not going to cover exactly all of these today, but certainly in videos to come, we'll be covering this. But this is this list: anterior hemiblocks, left bundle branch blocks, left ventricular hypertrophy, ventricular pacemakers, old or completed inferior infarcts, and something that is often referred to as athlete's heart. These are all different things that can actually cause this left axis deviation that we've been talking about today. All right, so furthermore, with left axis deviation, we kind of break it down a little bit in terms of left axis deviation that is physiologically okay, which is meaning that it's not necessarily detrimental to the patient. And then we can have pathological left axis deviation. And of course, when we're referring to pathological, we're meaning that there's disease process. And typically what we're seeing is that the efficiency of the left ventricle to fire off is going to decrease somewhat when we have pathological left axis deviation, okay? And the way that we're going to define those two or separate those is going to be physiological left axis is when that axis goes from 0 degrees to around -40 degrees. We're still, even though there is some shift in that axis, that typically most patients are still in an okay range. It's not necessarily considered a bad thing. Most of the time, those patients are just fine. When that axis shifts even greater to where we're now between -40 and -90 degrees, that's going to be our pathological axis, all right? So the two big differences there: physiological left axis versus pathological left axis. So a nice way of summarizing all this is going to be with an axis chart. And I certainly did not invent this. You can find this easily on Google if you search it anywhere under axis charts or axis determination charts. And this one we'll kind of work through. We'll kind of add as we go. But you can see on here, it's a nice way of summarizing or using as a quick reference for determining our axis deviation. So we already talked last week about normal axis. And when we think about normal axis, we look at our leads 1, 2, and 3. And all those QRSs are going to all be upright, okay, or positive deflected. Or if we look at the 12 lead itself and we look at the degrees measurement, it's going to be between 0 and +90 degrees. So now we're on to left axis deviation. So for our physiological left axis deviation, our degrees, as I mentioned in the slide before, is going to be between 0 and -40 degrees, or roughly thereof, 0 and -40 degrees. As far as our deflections go, we're going to have some changes, okay? So rather than all being positive, all right, that axis is now, because it's shifting to the left some, is moving away from leads 2 and leads 3, okay? And so that's going to change the average, or the direction or the deflection of those QRS complexes. So lead 1 is still going to be upright. Lead 2 now is going to be a biphasic or equiphasic, all right? And lead 3 is going to be a negative when we're talking about physiological left axis deviation. For our pathological left axis, okay, we're going to see that we're actually, lead 1 is still positive, okay. Lead 2, however, is going to be negative, and lead 3 is also going to be negative, all right? And I'll kind of show you what I mean by that coming up. Okay, so let's take a look at some examples. All right. So remember, whenever we're looking at a 12 lead, we need to start with our disciplined approach that always starts with step 1, rate and regularity, and then we'll look at our axis determination. So if we look at our 12 lead here, our ventricular rate is 58. So that, although it's a little on the slower side, that's not too bad. I look at my QRS complexes to see if it's irregular or irregular, and this is a regular rhythm. I'm then going to look at my axis, and if I look at my number, I can see that it says negative 34. So that's between our 0 and negative 40, which indicates that this is a physiological left axis. And if I look at my QRS complexes in lead 1, 2, and 3, I've got upright in lead 1. Lead 2 is biphasic, almost fully negative, which makes sense. And then lead 3 is also negative. So lead 2 is right there on the cusp of becoming fully negative, and that makes sense because our direction is negative 34. It's very close to negative 40, but regardless, right now we're still kind of in that physiological left axis deviation. All right, another example. So again, rate and regularity, step 1. I look at my rate, 79. That's a normal rate. I look at my regularity. This is indeed a regular rhythm. The QRS is marched out in a regular pattern. So I've got a sinus rhythm right now. I go to my axis determination, step 2. If I look at my numbers, it's negative 32. And if I look at my leads 1, 2, and 3, my QRS complexes, lead 1 is upright, lead 2 is biphasic, and lead 3 is negative. Again, indicating that we're dealing with a physiological left axis deviation. Next example, I've got a ventricular rate of 73. That's good. I look at my regularity, it marches out, so I've got a regular rhythm. And then I'm going to determine my axis, negative 21. That's between 0 and negative 40, indicating physiological left axis deviation. And then if I look at my leads 1, 2, and 3, I've got an upright lead 1, I've got a biphasic lead 2, and I've got a negative lead 3. Finally, I've got my 12 lead here that says a ventricular rate of 55, a little bit on the slow side, but typically okay. I look at my regularity. It is indeed a regular rhythm. I now determine my axis, negative 64. That is going to be between our negative 40 and negative 90, which indicates a pathological left axis deviation. I can look at my leads 1, 2, and 3. Lead 1 is upright. Lead 2 is a negative deflection of the QRS complex, and lead 3 has also got a negative deflection of the QRS complex, also further indicating that we're dealing with a pathological left axis deviation here. Okay, perfect. Well, hopefully this is really helpful, and that you got a clear understanding of what left axis deviation means, how we determine left axis deviation, and what that indicates may be going on within our patient. All right. Thanks for joining us again this week. I really hope this is helpful. We're having a ton of fun doing these videos right now. Please like this video if you do. If you haven't subscribed, please do. And it would mean the world to us if you recommended this series and our channel to other healthcare providers out there who may benefit from this. Thanks for joining us again this week to Pulse Education. We will see you soon.